Okay, so today we are going to talk about methylprednisolone, which is more commonly known as Medrol. I made a whole PowerPoint, but it doesn't want to cooperate, so now I'm just going to read it off my phone. So for drug class, Medrol is considered a corticosteroid and also an anti-inflammatory drug. So corticosteroids are synthetic analogs of steroid hormones, which are naturally produced by our adrenal glands. Our adrenal glands are located on the tops of both of our kidneys. And then for anti-inflammatory drugs, they are a drug class that are used as an antipyretic. So it reduces fever, anti-inflammatory, reduces inflammation, and is analgesic agent. So reduces pain. So for indications, I listed a lot of medications, or not medications, but indications for Medrol, but mainly in the pre-hospital setting. We're going to see this medication used as for respiratory distress patients secondary to asthma or COPD. And then we can also use it for spinal cord injury. It can reduce the inflammation that is caused by or brought upon the body by a spinal cord injury. But I also listed that it be used for arthritis, certain cancers, and certain immune system disorders. So for contraindications, obviously hypersensitivity is going to be a contraindication. But another one that I found to be a contraindication is systemic fungal infections, because how Medrol works throughout the body, it suppresses the immune system. So with systemic or any kind of fungal infection or infection in general, it can increase the risk of infection, but it can also increase the risk of the infection getting worse. So for mechanism of action, like I said, Medrol suppresses the immune system. So it binds with intracellular corticosteroid receptors, which thereby decreases inflammation. In comparison to prednisolone, it is far more potent as an anti-inflammatory steroid with greater anti-inflammatory potency, but it has less of a tendency to induce sodium and water retention. And then corticosteroids can decrease vasodilation and permeability of capillaries, and they also decrease the leukocyte migration to sites of inflammation. So that's going back to it suppresses the immune system. So for route of administration, Medrol is normally administered via IV or IM. When we are giving medications, doesn't really matter the route. We're going to consider the bioavailability, which is the amount of the medication that reaches systemic circulation. So for both IV and IM, bioavailability is the same for both, so it's 100%. So 100% of the medication reaches systemic circulation. So another thing to think about is via IM, it's also 100 because the first pass effect of the liver is passed as well. But it also should be administered slow, like via slow IV push, because there's reports of cardiac arrhythmias and or cardiac arrest following rapid administration. And then another thing to consider is when you rapidly administer any kind of corticosteroid, it can cause some patients to experience like a burning sensation. It's not really understood as to why, from what I've gathered, but it's just a thing to keep in the back of your mind. Just something that I've learned. So for onset of action for Medrol via IV, effects you can usually see within an hour. When the medication is administered via IM, you can see effects within 6 to 48 hours. So obviously in the pre-hospital setting, it depends on your transport time, but typically, at least for me in Jefferson County, transport times range from 5 to 15 minutes. We're not going to see the effects of a corticosteroid with the patient in our care, but later on it's going to benefit the patient. So for dosage, currently in West Virginia, there's not currently a protocol or I guess exact dose for Medrol to be administered. but there is national standard protocol. So when we look at the dosage for Medrol, it's split into respiratory and for the spinal cord injury. So for both adult and pediatric patients in regards to respiratory, it's 1 to 2 milligrams per kilogram. And then for an adult and pediatric spinal cord injury, it's 30 milligrams per kilogram via IV. And that is Medrol.